We asked people with dementia and their carers what it meant to be given a diagnosis.
When he told us the diagnosis, it was a shock, even though I knew something was wrong. But in one way, it was good to know. Because if you don't know what it is, you can't deal with it. But I could deal with it now, and I could fight it.
There was a relief that we knew that, you know, this is what was happening. So I would say a relief. And for my mum, she was, she had this great humour, and not that she knew she was being humorous at the time, I suppose, but, you know, he said to her, you know, Mrs. Brahim, you have what we call Alzheimer's. And she said, oh, well, thank God for that. I thought I had dementia.
When it was finally pretty much confirmed that was it, absolute horror. And for Hilary as well, because she'd been dealing with EMI for 12 years. So probably more than most people, we knew what was involved. And Hilary at that stage probably knew what I was. So absolute horror.
When you get the diagnosis, it's really important then to sit and plan for future, you know. Just talk about things that, you know, you don't have to sit around the table and get everything out in one go. But if you kind of head towards finding out what's important to, you know, to my mum or what's important to my dad.
When you've just been diagnosed, you're not going to set fire to the house. You're not going to do things like this. That you can still leave them for an hour. You know, do these things because eventually you know that you won't be able to do that. And then you just know your life will change.
The memory team came round within a few days of the diagnosis to the house to give us advice about sort of next steps, and they were talking about mainly legal issues, you know, writing the wills, setting up. I can't remember what they're called now, but you know, the financial side, so that I can write cheques for Joyce and things like that.
The low rate of diagnosis in Wales has an impact on patients and their carers. What are the benefits of early or timely diagnosis?
Those are really quite clear. It gives the patient choices, carers choices. It allows us to exclude treatable causes or manage comorbidity, mitigate the actual disease itself with medical and psychological and social interventions.
As someone working in a GP practice, what is it that we should be looking out for in terms of catching the earliest signs that something might be wrong?
I think one of the things we have to recognise is that there may be a myriad of symptoms and presentations. Unlike secondary care or memory clinics, whose patients already come readily packaged, we may see somebody with their first socially inept disclosure or behaviour. But that doesn't make a diagnosis, and so it's being aware, particularly at places like reception, where staff may notice that somebody rings up several times for the same appointment, or comes in and not quite sure why they've attended, or is failing to collect prescriptions. So these are relatively low things, which warrant just chasing up to see if there is any other reason why that might happen.
When someone has been diagnosed with dementia, what can be done?
Right. There are lots of things, both for the patient, the family, and if we talk specifically about the patient, one is reassurance and acknowledgement of what they have an explanation for their symptoms. And whilst many people may not welcome that diagnosis, it's a reality that has to be faced. And many people, the fear is greater than reality. Once into the memory clinic, there is the opportunity to be started on medication, which for certain types of dementia may stabilise the condition for a couple of years or more. And a few will actually have great benefit over many years.
What is it that people in primary care need to be thinking of in order to be sure that they are getting the best possible care?
That's a really good question, and it requires the clinicians to really decode the symptoms that the patient is presenting with. If you only have 4 or 5 ways of expressing all your needs, then there's some shortcuts being made. And so if somebody mentions pain, it may be that they have bumped themselves, it may be they have toothache, it may be they've got high pressure glaucoma, it may be they've got a urinary tract. There are a number of reasons why a patient may have pain. So understanding what is causing the pain is really important. The second thing is pain relief, and it's appalling. We all know as we get older we have more aches and pains, and this group is an ageing population, and yet we also know that their pain relief is poor. And this is not only an area for research, but it's an area where just starting off with very simple things like paracetamol suspension on a regular basis may make a difference.
When someone gets a diagnosis of dementia, there's the possibility that everything else gets knocked out of the picture. But what should we be thinking about in terms of keeping people with dementia as well as possible?
There is an argument for reframing dementia as a disability. So rather than defining them by an illness and a label, we look at how they can manage their symptoms. This is an illness, after all, that may take 3 years to diagnose, and the average life expectancy is 8 years. There's an awful lot of living to be done in that time.